The influenza pandemic of 1918, often referred to as the Spanish flu, stands as one of the most devastating health crises in modern history. Sweeping across the globe with unprecedented speed, this virulent strain of influenza infected millions of people, including those in the United States, and left a profound impact on American society. In this exploration, we delve into how America adapted to the Spanish flu, a crisis that forced communities and governments to implement a variety of measures to combat the spread of the virus. From quarantine and isolation efforts to public health campaigns and changes in daily life, the response to the 1918 pandemic serves as a crucial historical backdrop for understanding modern approaches to public health and pandemic preparedness. This is the story of how a nation grappled with an invisible enemy, made sacrifices, and laid the foundation for future responses to global health crises. Quarantine and isolation. Cities and states across the United States implemented quarantine measures to slow the spread of the virus. This involved isolating infected individuals and sometimes entire households. Public gatherings, including church services and public events, were often cancelled or restricted. Mask mandates. Some cities, such as San Francisco, made the use of masks mandatory in public places to reduce transmission. This was a controversial measure, but it was widely adopted in various locations. Public health campaigns. Local and federal governments initiated public health campaigns to educate the public about the importance of good hygiene practices, such as hand washing and covering one's mouth and nose when coughing or sneezing. Hospital expansion. Many hospitals were overwhelmed by the influx of patients during the pandemic. To address this, temporary hospitals were established in schools, community centers, and other available spaces. The U.S. Army even converted some barracks into makeshift hospitals. Changes in schooling. Schools in various parts of the country closed during the pandemic to limit the spread of the virus. Some communities implemented staggered schedules to reduce crowding when schools reopened. Limiting public transportation. Some cities reduced or restricted the use of public transportation to minimize close contact among passengers. Efforts to develop vaccines. While no effective vaccines were developed during the 1918 pandemic, research into influenza and vaccine development accelerated in the years that followed. This laid the groundwork for future vaccine development efforts. Societal impact. The pandemic had a profound impact on American society. It disrupted daily life, led to labor shortages, and caused a significant loss of life. It also underscored the importance of a robust public health infrastructure and preparedness for future pandemics. It's important to note that the response to the 1918 influenza pandemic was often decentralized, with local governments making many of the decisions regarding public health measures. This decentralization led to variations in responses and outcomes across the country. The lessons learned from the Spanish flu pandemic contributed to the development of modern public health practices and preparedness for future pandemics, including the COVID-19 pandemic.